Hello everyone, welcome back to my channel. So in today's topic we'll be talking about the different types of vaginal discharge and also the significance of the different types of vaginal discharge you are producing, and also when is the right time to see a doctor depending on the kind of vaginal discharge you are producing. So my name is Nay Yvonne. If this is your first time seeing me here, please kindly subscribe, like and turn on the notification bell, and don't also forget to share this video with your friends, especially the female ones. It might be of great help to them. So just stay tuned and keep watching. First of all, before I proceed into this topic, I'm just going to give you a brief explanation what a vaginal discharge is all about. So a vaginal discharge, it's normally a fluid. It's produced in the cervix and it leaks out from the vagina. So this fluid is mostly made up of cells and healthy bacteria. So these bacteria and the cells, they help to lubricate your vagina and also keeps it clean. That's why as a woman you need to be constantly observing the changes that are occurring in your body, because like we all know, a woman's body, it's so complicated. That's why you have to pay close attention. You have to monitor the texture of your vaginal discharge, the smell, the color, and also the quantity of vaginal discharge you are producing in order to know if it's normal or if it's a little bit out of range. So all of those things are going to determine if you have an infection or maybe there is a problem somewhere. So those are the things you have to always pay attention. So the first type of vaginal discharge you can see, it's the yellow greenish kind of vaginal discharge. So this vaginal discharge signifies STI. So when you start seeing this kind of vaginal discharge, that's the first thing that have to start ringing in your head, like it's sexually transmitted infection. You might have contracted a sexual transmitted infection, and it's usually caused by a bacteria known as Trichomonas vaginalis. Most of the times many people are not aware of this bacteria, but believe me, this bacteria is out there and it's existing, and equally contract that from someone through sexual intercourse. This bacteria, it's not really that common, but believe me, it causes a lot of health issue. So I know many people, when they come to the hospital, maybe with irritation, vaginal irritation, itching, burning sensation, they'll be expecting the doctor to diagnose something like herpes, chlamydia, gonorrhea, or maybe another kind of sexual transmitted infection. But at times they get surprised when the doctor tells them, like, come on, you are infected but with a bacteria known as Trichomonas vaginalis. So once you are infected with it, it's going to alter the color, the texture of your cervical mucus. So it's going to make your vaginal discharge to be kind of yellowish, greenish kind of color. So if you start producing this kind of vaginal discharge, definitely just know it might be caused by Trichomonas vaginalis. That's why you still need to go to the hospital and run some tests in order to confirm. But as long as you are seeing yellowish, greenish vaginal discharge, it's equally caused by this bacteria. Okay, and at times also, one funny thing about this infection is that it might be asymptomatic, like you might not have any sign. So it's a little bit tricky for someone who have multiple sexual partner. You might just be transmitting it from one partner to another, and definitely they will not know. And at times it might come with maybe some symptoms, like you might have burning sensation while urinating, you might have pain during sexual intercourse, you might have also itching and irritation in the vulva area, and maybe also the vulva area might be swollen. So those are some of the symptoms that you might see if the infection is coming with symptoms, but most of the times it's usually asymptomatic, and you can treat this by using normal antibiotics. By taking antibiotics is going to help eliminate this bacteria, but first you need to consult with your doctor so that your doctor will check on you and know the best type of medication to give you if you are infected with this. So in order to treat this sexually transmitted infection, the doctor is going to give you some antibiotics, and these antibiotics, once taken, you need to stay without having sex for at least 1 week. And make sure also your partner, your sexual partner, they take it also for it to work so well. So these are the things you can do in order to eliminate this. And once you have treated this bacterial infection, definitely you are going to start producing the normal healthy vaginal discharge. So this type of vaginal discharge I'll be talking here is the red to the pinkish color vaginal discharge. So this kind of vaginal discharge where you have pinkish to red color, it can be a normal vaginal discharge as well as it can be an abnormal vaginal discharge. So in the case where, let me say for example, you had a red to pinkish vaginal discharge when it was about time for your period, or maybe at the beginning of your period, meaning that one it's normal. Because when your period is about starting, like for example, if you go to the washroom and you use a tissue, or maybe if you look at your pants, you might find that it's kind of pinkish or reddish kind of vaginal discharge you are producing. So in that kind of a circumstance, that one it's a normal vaginal discharge. But in the case now of an abnormal vaginal discharge, it's in the case where you start having a pinkish or reddish vaginal discharge when you are almost expecting your period, some few days when you are expecting your period, and maybe the spotting is not really that heavy, it's just very light, and usually it doesn't wait up to a pad liner. Definitely it could be its implantation bleeding. This implantation bleeding, when the egg is being released and it's fertilized in the fallopian tube, when it's coming down to the uterus to implant itself, it might injure some of those blood vessels that are covering the lining of the uterus. So when that happens, the blood is going to leak out and it will come out now as spotting. So this is what is known as implantation spotting. This is not a normal red or pinkish vaginal discharge. It's as a result of this implantation. So the next reddish or pink vaginal discharge you might experience, it may be, let me say you have bleeding in sex or maybe 24 hours after sex. This might be as a result of maybe the tears or maybe the friction that occurred during the sex, and with this you might have blood leaking out. The next one that can lead to pinkish or red vaginal discharge is someone that was already on menopause, and for a period of 1 year you have not been bleeding, and of a sudden you start seeing some spotting or pink or reddish vaginal discharge. It could be as a result of endometrial cancer. That's why you have to seek for quick medical attention so that the doctor can easily diagnose and see what is wrong with you. So the next thing that can lead you to produce red or pinkish vaginal discharge is miscarriage. If you are pregnant and within the first week of pregnancy you start finding some reddish or pink vaginal discharge leaking out from your vagina, it could be definitely you have miscarried your baby. So you have to seek for quick medical attention. Another reason why you might be having pink or reddish vaginal discharge could be as a result of an intermediate menstrual cycle spotting. So as a lady, if you start seeing a pinkish or reddish vaginal discharge that you are producing, it could be as a result of any of these factors that I have mentioned. So the next vaginal discharge I'll be talking about is the cream white vaginal discharge. It can be normal and as well as it can be abnormal. So if it's just only cream and white vaginal discharge, we know irritation or nothing, meaning it's a normal vaginal discharge. But in case, let me say, the cream and white vaginal discharge is coming out thick, clumpy, and also it's looking like cottage cheese like, definitely that should ring a bell in your head that you are infected with yeast infection, which is known as thrush. So once you have this thrush, it's going to look like cottage cheese like, and at times it's creamy and also white. So that is the texture in which it looks like. So if you start seeing this, the first thing that should come into your mind should be yeast infection, which is thrush. This yeast is a normal resident of the vagina, which is Candida albicans. So they are also fighting with other healthy bacteria that are competing in the vagina. So in the case where, let me say for example, you are taking antibiotics, that leads to the death of these other competitive healthy bacteria that are found in your vagina, the yeast is going to outgrow and grow out of proportion without control. So when this happens, when the yeast cells, they grow out of control, they tend to dominate the vagina, leading now to the production of these thick, creamy, clumpy, cottage-like, cheese-like kind of vaginal discharge. That's why your vaginal discharge is going to be so thick, looking like cottage cheese. Finally, when you are infected with thrush, it might be symptomatic. In some instance, it might be asymptomatic. So in the case where it's symptomatic, at times the infection might go on its own. The pH of your vagina might become stable, and all the competitive bacteria and the yeast cell might be at a stable rate. So the infection is going to go on its own naturally. But in this where it's symptomatic and you start having this burning sensation, pain during sex, and you're having irritation, having itching and pain, definitely you need to seek for medical attention. And the kind of medication that can treat this is antifungal medication. And one thing about this antifungal medication is that they are actually of 3 types. You have the tablet format, which you can swallow, and you have the pessary, which you have to insert in your vagina. So most of the times people get confused. So if the doctor issue you the tablet format, you have to swallow. If in case it's the pessary format, you have to insert. And at times also they might issue you cream. Apply the cream in your vagina area. That is going to help you relieve you some of these symptoms. Like the next kind of vaginal discharge is the gray to greenish vaginal discharge. So this kind of vaginal discharge is being caused by a bacteria, but it's not usually associated to sexual transmitted infection, but it's usually common in women that are sexually active. And when you start finding this grayish to greenish kind of vaginal discharge, it will also come with this kind of fishy or foul kind of smell. And this smell is usually more intense when you are just from taking your bath, or maybe you happen to clean your vulva area. The scent is usually more intense and very offensive. So when you start having this kind of vaginal discharge with this kind of fishy and foul kind of smell, the first thing that should come to your mind should be bacterial vaginosis. So it's usually caused by this bacteria, and most of the times it might come with no symptoms. At times it might come with symptoms like itchy, burning sensation, and maybe your vulva area is swollen. You know, normally the vagina has very healthy bacteria. That is why if you look into details, this bacteria is not really a sexually transmitted infection. So when something happens that alters the condition that is keeping this natural bacteria within their normal growth level, and in one of these healthy bacteria tend to grow out of proportion, it will develop what is known as this bacterial vaginosis. And it usually occurs mostly when the pH of the vagina is being altered. So if the pH of the vagina is being altered and the vagina becomes more neutral, definitely it gives a benefit for these normal healthy bacteria to grow out of proportion. And when they grow out of proportion, out of control, it will lead to bacterial vaginosis, and in this state you will start producing a gray to greenish vaginal discharge, and also the vaginal discharge will be smelling fishy and foul, and the scent also is very offensive. So if you start producing this kind of fishy or offensive foul smell of vaginal discharge, even when you are just from showering and the scent is still very strong, definitely you should know it's bacterial vaginosis. That is the first thing that should come into your mind. And this also can be treated with antibiotics. You take some antibiotics and it's going to treat this infection. So the next kind of vaginal discharge I'll be talking about is the clear vaginal discharge. This discharge is the best and most healthy type of vaginal discharge. So majority of women, these are the kind of vaginal discharge they are producing. So if you have any of the other type of vaginal discharge, definitely they signify something. That's why you have to always seek for medical attention ASAP if it's not normal. So but this clear and white vaginal discharge is the normal type of vaginal discharge you will be producing. And also it varies, like at times the vaginal discharge might be very slippery, at times it's very thick, at times it's very stretchy also, and at times it's very watery. So it varies within your menstrual cycle depending on the state in your menstrual cycle. If you are ovulating, the quantity is going to be more, and the kind of vaginal discharge you'll be producing will be very sleepy, stretchy, and very wet and damp. So it will look like a raw egg white. So that is how it's going to look, something similar to that. So it varies depending if you are ovulating, if you're breastfeeding, if you're pregnant, so something like that, but it's the healthy type of vaginal discharge. And most of the times it comes with no scent, and if in case it has an odor, the odor is not usually offensive, it's very pleasant odor. So that's the kind of vaginal discharge. And with this kind of vaginal discharge, you will not be having any kind of irritation, no burning sensation, no itching, maybe no pain during sexual intercourse. So you will not be having any kind of vaginal irritation down there. So this is the most healthy type of vaginal discharge, which is the clear vaginal discharge. So with all of this, I'm going to be telling you some things that you can do in order to keep your vaginal discharge very healthy, and also for you to have a good vaginal discharge. The first thing I will be telling you is that you need to maintain a good hygiene. So when you go to the washroom, always make sure you clean from front to back. That means you take it from the vagina to the anus. If you take from the anus to the vagina, definitely you'll be taking poop from the anus to the vagina and taking out bacteria from the anus to the vagina also, which will definitely lead to irritation and infection for you. And then another thing also is that you can go mostly for cotton underwear. It's going to absorb the moisture, and it's also airing, so it allows air circulation to be in the vagina, and it helps absorb moisture. So but if in case you choose to go for nylon underwear, it's not that bad. But the thing is that if you are doing some kind of strenuous exercise outside and you are sweaty, definitely the nylon underwears will not be able to absorb the moisture, and definitely those moisture is going to serve as a breeding ground for those natural bacteria to grow out of proportion and cause infection. That is why it's always advisable to go for cotton underwears, because they are going to help absorb the moisture, allow air circulation, which will prevent those kind of things from happening. And then the next thing is that if you are having sex, always practice safe sex. Another point is that you need to avoid douching. When you go to the washroom, douching is the act in which people would take water and they try to, maybe they use a pump and they pump the water into their vagina to wash out dirt from their vagina. That is not advisable. That is known as douching. Avoid scented products, avoid hot water baths that have strong detergents. So these are the things that if you practice them, definitely you are going to have a good vaginal discharge. So vaginal discharge is classified under 4 headings: the texture, the color, the quantity, and the smell. So let's first of all start with the texture. So the kind of texture of vaginal discharge should be light, pastry, gauzy, and kind of sticky. So that's how a normal vaginal discharge should be. So if you start having a chunky, clumpy vaginal discharge, that is associated maybe with burning, irritation, and itching, definitely that is bacteria infection. And then when it comes to the smell of vagina, that's the odor of vaginal discharge. Vaginal discharge should have no odor, and if it may have an odor, the odor should not be so strong and it should not be unpleasant. And then the next classification of vaginal discharge is the quantity. Normally for some people the quantity can be more, for some people this quantity of vaginal discharge can be less, depending if you are breastfeeding, if you are ovulating, if you're on menopause. Those things are going to affect the quantity that you are producing on your vaginal discharge. And the last one also is the color of your vaginal discharge. Normally the color of vaginal discharge is usually clear. It can be milky white, and at times it might be off-white. So these are the colors of a healthy vaginal discharge. If you start producing greenish, yellow, gray kind of, and then the smell is foul, fishy, know that there is something wrong with your vaginal discharge. So this is how a healthy vaginal discharge is being classified, based on the texture, based on the smell, based on the quantity, and based also on the color of the vaginal discharge. So if your vaginal discharge falls within these 4 characteristics I've mentioned, definitely you are producing a healthy vaginal discharge, especially if you have all of this with no irritation, no burning sensation, no pain, or no other kind of side effect, meaning the kind of vaginal discharge you are producing, it's very healthy. So stay tuned. If you have been watching me without subscribing, please kindly subscribe, and don't forget to like and share this video. I love you all, and please do stay safe. Ciao.